This year, over 2 million people will be diagnosed with cancer. Over half of those will be on Medicare. And in this video, I'm going to show you which Medicare plan will provide for you the lowest cost possible if you ever get a cancer diagnosis. Now, once we're on Medicare, we have two options for using our Medicare benefits. When everyone's on Medicare, they have to choose one or the other. We cannot be on both. So there's two different ways in which we use our Medicare. One of those ways is to stay in original Medicare A and B. And when we stay in A and B, what that simply means is that we can go to any provider that takes Medicare, and Medicare is going to be the first payer. And Medicare pays decently, but it does not pay for everything. So when we pull out that A and B card, Medicare is going to pay, but there will always be a balance that we're responsible for, because other than preventive, Medicare doesn't pay anything 100%. So there's always a liability, a financial responsibility that you have. We call those gaps in your coverage. And there are 6 gaps you're responsible for in Medicare, 3 on the A of Medicare, 3 on the B. So the A of Medicare is the inpatient side of Medicare called hospitalization. We have 3 gaps. The first gap is what we call the A deductible. Now, the unique thing about this deductible, it is not an annual deductible. This deductible actually can occur more than once in a year. So someone goes to the hospital and is discharged, and then the next 60 days they're still under that same deductible. But if they don't go back to the hospital after being discharged within that 60-day window, but they're hospitalized later, then they go back to the hospital and start a new benefit period and have to pay another deductible in the same year. All right, now that deductible is all we have to pay out of pocket for up to a 60-day stay in the hospital, which is going to be probably 99% of every situation. But if someone's in the hospital longer than 60 continuous days, now we start paying daily copays. This is our daily copay for month 3, and this is our daily copay for month 4 and month 5. This month 3 would cost you about $12,000. Month 4 and month 5 would cost you about $25,000 each. These are called extended hospital stays. They're not very common, but when they do occur, as you can see, they're expensive. So that creates our second gap. And our final gap on the A of Medicare is for skilled nursing. Now, here's the way it works. Medicare, the first 20 days in the skilled nursing facility charges you nothing. You're zero out of pocket as long as you had a 3-day stay in the hospital. Then you can go to the skilled nursing facility. Medicare covers everything the first 20 days. But if I'm in longer than 20 days, now from days 21 to 100, I now have a daily copay that I'm responsible for to that skilled nursing facility this year, $194.50. So those are our 3 gaps on the A. On the B side of Medicare, we also have 3 gaps. We have a deductible. Now, fortunately, the B deductible is just once a year. It's a calendar year deductible that resets every January, but we only have to meet it once. And once we've met that deductible, then we're responsible for our second gap, which is called 20% co-insurance. So anything on the B side of Medicare, which is all doctor services and everything outpatient, Medicare pays 80% and you pay 20%. Now, the problem with your 20% is there's no max to that. There's no limit to that. And the biggest problem is that's where all the docs are paid. So if we have a serious issue such as cancer, every doctor we see, if we have a surgeon that operates on us, and an anesthesiologist is in the room, all those physicians, we're responsible for 20% with no limit on that. And then lastly, there's a possibility that you go to a doctor that adds to the Medicare bill. Doctors are allowed to do this. Most don't, but some do. And when they add to the bill, they add 15%, and whenever that happens, you're responsible to pay for it. And again, there's no max. Guarantee it. Go to Mayo Clinic, Cleveland Clinic, some of these places, they always add that 15% to the bill. So those are our 3 gaps on the B of Medicare. So here's what happens. Most people that stay in this system don't like all of that liability, so what they will do is they will get plans to cover those gaps, either fully or almost in full. Most people today are getting one of 3 plans. They're getting an F plan, they're getting a G plan, they're getting an N plan. All right, I'm going to start with least amount of coverage. The N plan actually will cover all these gaps right here, cover all those gaps, and covers that gap. So on the N plan, what's happening, you're responsible for the B deductible, you're responsible for excess charges if and when it occurs, and every time you see a physician, you can have up to a $20 copay. The next plan above that is the G plan, and it pays excess. The only thing it doesn't pay is the B deductible. It covers everything here, all these. So when someone has a G plan, which is the most popular today, pays everything but the B deductible. Now, the F plan is still a plan available for some people, anyone born before January 1st, 1955, starting Medicare before January 1, 2020, can buy an F plan. And what it does, it also fills in that one gap there. So it covers all the gaps. Okay, G covers all but that one, F covers all of them, and covers all but a couple gaps. And so the F plan is available as long as you were born before January 1st, 1955, or started Medicare before January 1, 2020. Okay, so we stay in original Medicare, we get a supplemental plan to fill in the gaps. That's one option of using our Medicare.
Hey, my name's Josh Music. My dad, Marvin Music, who if you've been watching his video, has a free gift that we set up for you. It's right up here. If you click right up here on the right-hand side of your screen, there's a little eye, click on that, and you'll be taken to a page where you can put in your email and access this free gift that he's prepared for you. So go ahead, do it, and then get back to the video.
Now, the second way we can use our Medicare benefits is to have an Advantage plan. These are called replacement plans or C plans. And this is a private health insurance company that's put together a network of providers and a schedule of copays that you'll be responsible for. Now, to have an Advantage plan, we have to have Medicare A and B. Got to be enrolled in Medicare A and B. All right, so here's the differences. When we're on an Advantage plan, you'll notice we're going to have now a network of providers, either HMO or PPOs. Now, if I stayed in original Medicare, I didn't have a network. I can go to anyone that takes Medicare, any hospital, any doctor that takes original Medicare, I can go there. Here, now I have to find out, does that provider take my Advantage plan, which means what? If I'm going through cancer, I may have some issues here, maybe some limitations, because not every doctor is going to take the Advantage plan. So we have two networks, HMO and PPOs. Now, HMO we describe here with a smaller box because there will be less doctors, less hospitals that take the HMO. Now, some people still enroll in an HMO because the HMO package is a little better financially. HMOs have lower copays typically, lower max out of pockets as well. PPOs, a little higher copay, a little higher max out of pocket, but on the PPO, we have the right to go out of network. On the HMO, we must stay in our network unless it's an emergency situation or an urgent care situation. So if I'm on a PPO, I can go out of the network. Any provider that's going to take Medicare that'll take the plan, you can go there, which means if I'm going through cancer, I'm going to have a lot more options if I'm on the PPO versus the HMO. Now, the greatest amount of options will be if I stay in original Medicare. Just one more set of details that matter with the Advantage plans, and that's this. Advantage plans have lower no monthly premiums. Now, I'm still enrolled in Medicare A and B. I got to pay my B premium, but that insurance company typically is going to charge me zero, or if there is a premium, it's going to be very low. Well, why is that? Well, because instead of paying a premium to them, what I'm going to do is I'm going to pay copays for all the services that I receive until I hit what is called the annual max out of pocket. So this is my limit. So I'm not going to spend any more than $4,000 to $10,000 for the whole year. And so the whole point is, if I had a supplemental plan, I paid a premium and pretty much eliminated all my out-of-pocket expenses except my B deductible. Here, I didn't pay a premium, but I'm going to take on the risk of whatever healthcare services I'm going to need until I hit my limit. And so what's happening is I'm paying copays. In other words, my wallet is out and I'm paying expenses. But once I reach the max that's established by the plan, then we can put our wallet away and the plan will pay 100% of all the expenses until December 31, and then January 1, these numbers will reset, and then we start paying copays again until we hit our max. Now, when someone gets diagnosed with cancer, we're not exactly sure what type of services they're going to need. That's going to vary depending upon the cancer they have and the severity of it. But these are the typical services that are needed for cancer treatment, okay? So diagnostic visits simply means you're going to your primary care doctor and specialists as they analyze your cancer and what type of a treatment plan you're going to need. Certainly there will be some x-rays involved, probably some scans. That could be an MRI, a PET scan, a CAT scan for sure. And then more than likely, if you're going to get treated, there will be some type of a surgery with a potential hospitalization tied to that surgery for recovery. And then radiation, common, chemotherapy, also very common, and certainly some medications that you'll be taking in the hospital, as well as some that you'll self-administer. All right, so these are very typical services for cancer. So what we're going to look at is what will it cost us for these services if I'm on the supplemental plan, and what will they cost upon the Advantage plan. All right, so let's look at the supplemental plan. Now remember, I'm using as my example the Plan G. Now, there are 6 gaps in original Medicare. All those gaps are covered, but what? The B deductible is the only out-of-pocket expense I have as far as healthcare services, and this year that's $233, okay? So if I'm getting these services right here, what's happening? I will be responsible for the first $233 of any of these bills, just the first $233, and then after that, I have 100% coverage because this is the only gap that my G plan did not pay. So what does that mean? After I've met my B deductible, my x-rays, my diagnostic visits, my scans, my surgery, my hospitalization, chemotherapy, radiation, everything is going to be zero. Now my medications that I self-administer, I'm going to have some copays because that'll be paid through my prescription drug plan. But everything else is going to be zero. Why? Because I only have to pay $233, and then I would have to pay that again, of course, once the next year when that resets in January. But for the whole year, for my cancer treatment, I would only spend $233 out of pocket for these services. If it's time for you to go on Medicare or switch a plan, it would be our privilege to help you. Our services are totally free to you. We are independent brokers, which means we are truly unbiased in the information that we share with you. If you'll reach out to us through our website, MedicareSchool.com, you can schedule an appointment. We're in the pinned comment below, and then you can always call into our office as well, 7 a.m. to 7 p.m. Central Time, and you will be assigned a guide, a Medicare guide, which is our agent, and they will walk you through the entire process. We can help you with your SSA.gov account, help you enroll into Medicare A and B, help you with Social Security if you would like that as well. Anything that you need, we can help you with truly A to Z. And the great thing is our services are totally free to you. The insurance companies always pay the agent, so we come at no cost to you. And we have a wonderful customer support team as well. It'd be our privilege to help you. Reach out to us if you'd like some help. Thanks. Now let's look at what this scenario looks like if I'm covered by an Advantage plan. Now remember, on the supplemental plan, I paid a premium, got rid of the risk. Here, I don't have to pay a premium to the Advantage company, but instead I'm going to have to pay copays and different out-of-pocket expenses for my services until I hit my max. Now remember, my max is going to be somewhere between about $4,000 to $10,000, all right? And so what's going to happen? These diagnostic visits are going to be to my primary care doctor, to specialists, oncologists, and different doctors I will see. Usually primary care doctor visits are zero, but specialist visits are going to be somewhere between $25 to $50 every time I see a specialist. X-rays are going to be on the average of about $50 per x-rays. You'll notice our CAT scans, our PET scans, MRIs, those kinds of things are going to be anywhere from about $150 to $250 copay. And again, that is per scan. If I go to the hospital, I have a surgery, what's going to happen is they're going to charge me a daily copay. Right now, the average is about $350 a day from days 1 to 6. After day 6, there's no cost for that. But each hospitalization, I'm going to be responsible for a daily copay till I hit that particular limit. Now, that $350 a day covers every service I receive that day. It could be for my surgery, it could be for just normal care, but whatever is happening that day, all the services I receive will be covered by the daily copay. Now, radiation, you're typically going to be responsible for 20% of the radiation, and then your chemotherapy will also be 20%. And again, on the medications, if it's inpatient, outpatient, it's going to be covered by the Advantage plan. If it's I self-administer, I'm going to have copays for that. So as you can see now, instead of paying a premium, now I'm paying copays. So depending on what services we're going to need, those things can add up very quickly, and then more than likely we're going to hit our max out of pocket. In fact, the great majority of all people that get cancer while they're on the Advantage plan are going to max out. So those are our two systems. Now let's make a cost comparison. If we're going to be treated for cancer, what it's going to cost us, the G versus the Advantage plan. Now, if I have a plan G, that means I'm enrolled in original Medicare A and B. The A premium is zero for most people. The B premium this year is $170.10 a month. Now, the premium for our Plan G is going to vary throughout the country, and this depends upon your age and your gender. But on the average right now, most people are paying around $125 a month for their Plan G. And yours could be a little higher, a little lower, depending upon where you live. And then we have a drug plan. Now, there's usually 15 to 25 drug plans in every area. Right now, the average drug plan costs $30 a month. Okay, and so what I'm saying is that throughout the year we paid these monthly premiums. So if I take that number 12 times those, that means I'm going to spend $3,901.20 in my monthly premiums. If I am treated for cancer, I'm certainly going to see doctors and do some outpatient stuff. So I'm going to be out of pocket my B deductible, which is $233 for the whole year. So what have I spent during the year, max out of pocket, with all my premiums and my B deductible? I spent $4,134.20. Okay, I've had everything covered with my premiums and my annual B deductible. Now, if I'm being treated for cancer, I'm on the Advantage plan. How is that going to look? Again, if I'm on Advantage plan, I got to be enrolled at A and B, so 0 for A, and I got $170.10 a month that I got to pay for my Medicare Part B premium. Most premiums on Advantage plans are 0. Most Advantage plans also include a drug plan with a 0 premium for that as well. So all I have spent thus far would be my 12 months of premium for my Medicare Part B. And that is $2,041. Okay, now here's what's going to change. You'll notice now I got my out-of-pocket expenses, and we looked at diagnostic visits and scans and x-rays and hospitalization and surgery and radiation and chemotherapy and medications, all those things. We don't know what that's going to be. But remember, we said most people are going to max out when it comes to their plan. So if they're on a plan, let's say max out-of-pocket is $4,000, we're going to come over here and we're going to add that $4,000 to it. So what did they spend? They spent $6,041 for the cancer. Now, if their treatment is, their max out of pocket is $7,000, they spent $9,041, depending on where that's going to be, because again, everyone that gets treated for cancer is going to max out for the year. And so as you can see, you're going to spend substantially more on your Advantage plan than you would on the supplemental plan, because you took on the risk of those co-payments, and of course you got diagnosed with something very serious, which is cancer. Now, the worst thing that can happen, and I've had it happen before, is when people get diagnosed with cancer towards the end of the year. They'll max out usually within 2 or 3 months, and then these max out of pockets reset every January, and then they're going to max out again. Had a lady not long ago got to breast cancer. Her max out of pocket was $6,750. She maxed out within 3 months. Cancer treatment carried over into the following year, and again within a couple more months, she maxed out again, $6,750. And so as you can see, what happened? She spent $13,500 within just a matter of a few months because of her cancer treatment, causing her to max out twice in a very short period of time. So folks, I think it's pretty obvious to see which one of these would cost you the least amount of money if indeed you had a cancer diagnosis. I want to close with a true testimonial, and I get these kinds of letters on a frequent basis. But I thought it was very appropriate to read this to you today. This gentleman writes to me, in May of 2020, I was diagnosed with cancer. In July, I began 6 weeks of daily radiation treatments and chemotherapy treatments, weeks 1 and 5. Over $125,000 billed to Medicare, and that was just the treatments. Since then, I've had multiple PET scans, CAT scans, MRIs, visits with surgical oncologists, urologists, and follow-ups with oncology staff at Sarah Cannon Cancer Center. Last Monday, I had my 2-year CAT scan, and next Monday, meet with my oncologist to go over the results. Since my 18-month scan was clear, we expect this one to be clear also. The point is, he says, as I have paid an annual deductible, $233, he was on a G plan this year, and nothing more than that. Without Medicare and my supplemental plan through Plan G, I could never have been able to afford anything close to those costs. I was forced to retire for health reasons and live on a fixed income. While the premiums for supplemental plans are not cheap, it is manageable. And you see, the point is, he was covered by a G plan, and his out-of-pocket expenses were substantially less than it would have been had he been on the Advantage plan.